Medical education is terrible, and it took me a long time to unlearn a lot of the things that I picked up there. And so today I'm going to talk about some of the main issues with it. Now, the first problem with medical education is that we really focused on treating issues at the root cause. When it comes to really common problems, things like obesity, diabetes, depression, we are not treating these at the source of the problem. We are masking the conditions with symptoms. Doctors aren't trained to help people with lifestyle interventions like diet and exercise and counseling. In fact, what we normally do is we just mask the symptoms of these conditions with medications, and the problems just fester and the people get worse over time. And it's just a disaster. The next thing that I noticed about medical education is that it is so influenced by the pharmaceutical companies. It's not even funny. And many people don't realize this. In fact, many of the professors that run the academic institutions are running clinical trials for the drug companies. And because of that, they have very pro-drug views. And the doctors who are trained by them end up having those views as well. And so what I see happening is that a lot of doctors are actually advocates for drugs, things like antidepressants. And if you criticize them, all of a sudden they say things like you're harming them. They have this completely unrealistic view about the benefits of the meds, and they really minimize the harms. And they don't realize that they've been really manipulated in this way. And the final thing that I really don't like about medical education is it's not training doctors to really help people have better lives. It trains them for a dysfunctional system. It trains them to be kind of this cog in the machine where they work in the insurance-based system and they see patients in 15-minute visits and they prescribe meds. A lot of these problems, you can't treat them in these 15-minute visits, and they're not treatable with medications. Unfortunately, a lot of people don't realize this. And that's my take on medical education.